Morning. You know, as more Americans are getting vaccinated against the coronavirus, it may have you wondering what's safe for your children, since a lot of them cannot be vaccinated yet. Dr. Keith Armitage is an infectious disease specialist with University Hospitals, and he joins us now. Doctor, first of all, thank you very much for taking time out for us this morning.
Yeah, thanks for having me.
I want to talk about the latest information that we're finding out now about Pfizer announcing that you may have to get a booster shot between 6 and 12 months from now. Talk about that, and is that a surprise to you?
Not really. I think there was speculation that people may need additional shots. I know in the Pfizer trial, they drew people's blood at 6 months, and they found they still had good antibody levels, but they're going to continue to monitor. And I don't think we know yet, but particularly with the variants, we need high antibody levels, and it seems somewhat likely that at some point we'll need a booster.
Doctor, talk about the variants that are out and about right now and of major concern.
Yeah, right now in Ohio, we're seeing this B.1.1.7 variant. This is what people think is responsible for this surge in Michigan. I think luckily in Ohio, we have pretty good vaccine penetration, but this variant is just much more contagious. It spreads easier, and it's becoming the dominant variant here in Northeast Ohio. For
those who've gotten the Moderna shot, do you think they're going to need a booster shot as well? Is this something that's going to be across the board?
I think it's likely. Moderna and Pfizer are very similar vaccines, and they're both highly effective, very, very safe, which is fantastic. But it seems, somewhat likely that we'll need a booster of these mRNA, Pfizer and Moderna vaccines.
Final question on this subject. Do you think this is going to be something that we have to do each and every year, like the flu shot?
Yeah, I think it may be likely. With the flu shot, we need a new shot every year because the virus is different. In the case of the COVID-19 vaccines, we may need a boost just to increase our immunity to that specific virus. It remains to be seen what happens with this virus. The good news is, these mRNA vaccines really work well. They're incredibly safe.
Okay.
And it really is the way out of the pandemic.
Okay. Let's talk about a family situation. The parents are vaccinated, the kids are not. With that situation, what are the do's and don'ts?
Yeah, I would avoid taking the kids to large indoor gatherings of people without masks. The way this virus is spread is really indoors around people you don't normally associate with unmasked. Outdoor venues are much, much safer. Even though kids are not, hospitalized acutely, we're seeing more and more of these cases of sort of post-COVID inflammation. Several weeks after having a mild case of COVID, these kids are getting fever, heart inflammation, and being hospitalized. So we know it's a much less threatening virus in kids, but it can be serious. We're also seeing some kids that have this sort of long COVID syndrome where they're affected for months and months. So we still want to avoid it in kids. I think we'll probably have vaccines approved for kids, in a few months. Mm-hmm. But for now, avoid indoor large gatherings, restaurants, bars, indoors with unvaccinated children.
At one time it seemed that grandma and grandpa were the ones at risk. Now it seems the kids are the ones at risk?
Well, grandpa and grandma are vaccinated, and these vaccines are incredibly effective in preventing death, hospitalizations, and preventing people from being on a ventilator. So grandma and grandpa are vaccinated. The kids are at lower risk, but they're the ones vulnerable now because they're not vaccinated. We have to be a little bit careful with them. The good news is the weather's getting better. Outdoor activities are so much safer than indoor activities. Just avoid indoors with strangers unmasked.
Doctor, why are we seeing a surge in cases now? And are we talking about a surge in cases in younger people, or what are we looking at?
We are. I think we're seeing a surge in cases for two reasons. We're seeing this more contagious variant now establishing a foothold in Ohio, as one would predict. I think all of us let our guard down a bit. Good news, the vaccines cases are down, so I think there's been a little bit of less compliance with some of the social distancing and masking measures. I think if it wasn't for the vaccine, we'd be seeing many more cases. And we are seeing younger cases in the hospital.
Yeah.
Here at UH, we've not seen any person with a normal immune system get admitted with COVID who's had the vaccine. And we're seeing people in their 40s and 50s and 60s who haven't had the vaccine get admitted. 12 months ago, 8 months ago, we were seeing, elderly patients, when we didn't have the vaccine, get admitted. So it is a bit different. I think the message is, get these mRNA vaccines, and we'll see what happens with Johnson & Johnson.
One final question, and I want to real quickly, will we ever reach herd immunity, or is that out of the question when the way things are looking right now?
No, I think we will. I think even though the Johnson & Johnson vaccine is in question, we don't know what's going to happen. I think we're going to have more and more of the Moderna and Pfizer between natural infection and immunization. I think we'll get there. People need to be patient. People are understandably so sick of this pandemic. Be patient and really urge people to get vaccinated. More than 100 million Americans have got these mRNA vaccines, so that the safety signals are really exceptionally positive for these vaccines. They are the way out.
Dr. Keith Armitage with University Hospitals, thank you for your information and your expertise this morning, my friend.
Thanks for having me.
All right.